You can go ahead, Nancy.
Good morning, and thank you for tuning in to the Government of Newfoundland and Labrador's news conference. I'm Nancy Hullett with the Department of Health and Community Services, and I'm the moderator for today's question and answer session. Joining us today is the Honorable John Haggie, Minister of Health and Community Services, and Dave Diamond, President and Chief Executive Officer of Eastern Regional Health Authority. Minister, please go ahead whenever you're ready.
Thank you, Nancy. Good morning, everybody, and thank you for joining us today. While our healthcare system has been tested in recent years, from the pandemic to the recent cyber attack, Newfoundlanders and Labradorians have shown great resilience. Our healthcare workers have worked tirelessly to continue to deliver quality healthcare, and the leadership and staff in our healthcare system have faced each new challenge with determination and grit. While the cyber attack was very disruptive for our healthcare system, you rose to the challenge and continued to deliver quality healthcare. I want to thank the leaders and dedicated employees at our regional health authorities and the Newfoundland and Labrador Centre for Health Information for their work and continued efforts. The strength and perseverance of everyone in our healthcare system and those working behind the scenes to support the continuation of services is really just remarkable. We also know how challenging this was for many of you receiving healthcare services, and we thank you for your patience and understanding. During the early days since the cyber attack and in the months since, you've shown an unwavering commitment to ensuring patients receive the best possible care, no matter the circumstances. And for this, I thank you. The past number of months have put added pressure on our healthcare system as we've been forced to manage what is unfortunately a more common occurrence around the world. Cyber attacks are happening with increased frequency, and other jurisdictions have had similar experiences to ours. Though the initial threat has been contained and our health services have been restored, we understand now more than ever the importance of continued vigilance and the need to strengthen our systems to prevent future attacks. This has and will continue to mean enhancing our security processes, our tools, and behaviors within the healthcare system. These measures will create additional layers of protection that will strengthen our security and prevent future cyber incidents. We must also reflect on our individual approach to security and take measures to ensure that we are all doing our best to protect our data from vulnerabilities. We are committed to creating a culture that promotes and follows best practices for security and privacy. This will need the cooperation and commitment from all regional health authorities and healthcare professionals across Newfoundland and Labrador to work with us to protect and secure health data and information systems. Together, we will ensure the continued delivery of healthcare by minimizing disruption to the delivery of care. As the investigation into the cyber incident by other agencies is ongoing, we're committed to keeping you as informed as new information becomes available. Today, David Diamond, the President and CEO of Eastern Health, will provide an update regarding some further patient health and employee information that has been identified as being involved in the cyber incident. Work is underway to ensure relevant individuals are notified, including about access to Equifax credit monitoring and identity theft protection services at no cost to themselves. We obviously regret that this incident occurred. Finally, I would mention that at this stage of the investigation, we have a good understanding of the information involved now in this incident. While we do not anticipate further updates will be necessary, should the situation change again, obviously, we will keep the public informed. So now I'd like to pass the microphone over to Mr. Diamond for an update on the investigation. David?
Yeah, thank you. Thank you very much, Minister Haggie, and welcome everyone. Let me start out by adding my appreciation, as the Minister has said, to the staff of the regional health authorities, Eastern Health and all the regional health authorities, in fact, and NILCHI as well for their continued support through the last couple of years and the many challenges that we faced. The commitment that everybody has shown to delivering care and health and wellness in the province has been nothing short of extraordinary. We also want to express our appreciation to our patients for continued support and patience as we've navigated through the many challenges we've had over the last couple of years. All of this support means a lot to us, and frankly, we wouldn't be able to get through what we've gotten through without our partners, without our staff, without our support from our political leaders and officials of government, and we really appreciate that a lot. Since the cyber attack, we've been working very hard to determine what information might have been taken. The public was first notified in November of 2021 that some personal information and personal health information was taken during the cyber attack by an unauthorized third party. We've since determined that additional information was taken during this incident. Over 200,000 files were taken from a network drive at Eastern Health's IT environment, and a portion of that may contain patient information and employee information. We're currently doing the work, undertaking a manual review to determine the exact number of files that contain personal health or personal information. A number of these files contain various types of personal information and from various time periods, some dating back as far as 1996. This information may include medical diagnosis, procedure type, MCP number, and ordering health care provider for some healthcare services that are provided in laboratory medicine, in the medicine program, in surgery, in cancer care, and the cardiology program, among others. It also may include human resources and administrative information. We're continuing our thorough review of these files, which will take some time, and this will help us determine the precise nature of the information contained in the files. Once we determine the information, we will be sending letters to any individuals, affected individuals whose information is contained in the files, and advising them of the privacy breach. The notification letters that affected individuals will receive will also have a direct information line where questions about individual situations can be answered. We encourage those affected individuals to contact this phone line when they receive their notification letter. General questions about this incident can be directed to the provincial toll-free information line, and that number is 1-833-718-3021. Now, this phone line won't be in a position to answer specific individual questions about individual patients and their individual information that may be involved, but certainly can provide some general information if people are concerned. We also remind individuals that we have entered into a contract with Equifax Canada to provide credit monitoring services for affected individuals. We've now extended the deadline for enrollment to the end of this year, to December 31st, 2022. And we're in the process of activating a new web portal, which will be available in the coming weeks to make the registration process a little easier than it is. In the meantime, even now, if you go into the websites, you'll get a phone number. You can call the phone number and enroll in the process that we've used over the last number of months, and that's still available. As the minister said, we all take within the health system, within government, within NILCHI, the regional health authorities, we take confidentiality and privacy very seriously, and we deeply regret that this incident has occurred. We'll continue our ongoing work into the future, and our commitment is that we'll individually notify individuals as we find information, as we get through these 200,000 files that we've talked about, if we find that information has been compromised. We can assure that we're continuing as well to implement further measures around IT security, and that'll help protect us all. Thank you again for your attention and for being here this morning. And I'll pass things back, Minister Haggie, to you.
Thank you. Thanks for the update, Dave. We appreciate your efforts to keep people informed. Anyone involved in this update will be contacted, as Mr. Diamond said, directly by Eastern Health. We want to thank you and all of our health authority CEOs for leadership throughout the pandemic and for navigating this cyber incident. We're very appreciative of the continued patience and resilience of the public and those we serve as we've worked our way through this. We recognize, however, that this matter may be stressful for some individuals, and should that be the case, there are resources available online or through your primary care provider. We're committed to keeping you updated, as I said, if any new or relevant information comes to light. So with that, I too will close, and I'll hand it over to Nancy to moderate the question and answer period. Nancy?
Thank you, Minister. For the benefit of our speakers, we have 8 reporters joining us today. The first round of the question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions today are from Ben Cleary with NTV. Please go ahead.
Hi, thank you, Nancy. My first question is for David Diamond, and that's, when did Eastern Health first find out that these 200,000 files had been taken? And is there any estimate on how many patients or employees could be impacted at this point?
We became aware at the end of February, I think February 25th. We had conversation with Nilchi to get confirmation that these files were amongst the files that were breached. We don't yet have an estimate of the numbers. Work will be happening, is happening now, and has been happening since the end of February to understand the magnitude. As you can imagine, with 200,000 files, and there are literally millions of data points. So there's a lot of work and manual work involved before we can put a final number. But we expect the number could be large, could be thousands of individuals at the end of the day between staff and patients. But that'll become clear as we do the work over the next 6 to 8 weeks.
Thank you. And my next question is for Minister Haggie, and that's the province wasn't able to disclose who was behind the cyber attack or what they wanted when it was first identified. But at this point, are you able to disclose any of that information about who is behind this or what they want?
There are areas of these investigations that are underway by other agencies. I think it would be fair to say, however, that there is a significant security element to all of this. And so I'm not able to answer that question at the moment, Ben.
Our next questions are from Peter Jackson with The Telegram. Peter, please go ahead.
Yes, I'd like to follow up Ben's question about the number of patients affected. You said last December that there were 2,500, I believe, patients who had their social insurance numbers accessed. Do you expect that number to go up now with this new finding?
Yeah, so far in the work that we've done, financial information and SIN numbers does not seem to be the issue. So we're not finding that. I can't say that as we continue the work, we won't find more, but we haven't so far. So again, as we get through and we find, the specifics in all of the data points, if there are issues around SIN and or financial information, that obviously will be disclosed to individuals. But so far in the work that we've done, we're not finding that to be the issue here.
Thank you. And perhaps the minister could answer this. Do you have any kind of an estimate as to how much this has cost the province so far?
Not clearly. We're hoping to have some figures around budget time. Obviously, we'll have some estimates there, but we just need to get this sorted out, and the bill really is what the bill will be.
Our next questions are from Mark Quinn with the CBC. Please go ahead.
Yes, thank you. Can you say if any patients or employees have had their information misused? Has there been any harm to any patients or employees at this point?
So we're not aware that any of this information has been misused. In fact, we're not aware even of the financial information and SIN numbers that we talked about earlier in the year. So none of that has been misused as far as we have been made aware. I mean, there's a lot of monitoring happening with the cyber experts that we have, folks who are searching the dark web and trying to ensure that if something were to be out in to be misused, that we would know about that. We're not seeing that. We are seeing some things like my own personal emails, for example, are out on the dark web and that sort of thing. But the experts tell us that that is not unusual and likely not related specifically to this incident. Things like emails and passwords and so on out in the general public, if you were to have access to the dark web, you probably would find that many of us have some personal information because of the way we use internet for purchases and so on. So, but in terms of personal financial information and the health information, we're not aware that any of that has been misused at this point.
And as a follow-up, did the province receive an encryption key that helped them rebuild it, or was it rebuilt from scratch from backups? Can you say?
That information is not going to be made public, Mark. There are certain security elements around this, and we have involved national agencies, and we've been advised that there should not be an answer to questions like that.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. Is there any indication yet as to what weaknesses there were in the system that allowed this to happen?
Again, it's going to sound awful, but we have identified things that we are rectifying. The nature of those is confidential for reasons of security. So we won't be talking about that in a public arena.
And do you have any idea of how many people have taken advantage of the credit monitoring services up to now?
I've got that data as of March 20th. We have 2,270 clients, and across the 3 affected regional health authorities, we have 13,366 current or former employees who have registered with Equifax.
Our next questions are from Sarah Smelly with the Canadian Press. Sarah, please go ahead.
Hi there. I'm wondering if you can explain, you indicated, Mr. Diamond, you indicated that you became aware of this latest breach at the end of February. I'm just wondering if you can shed some light on why there's been a delay between the discovery and then this announcement today.
Well, I think the delay is indicative, I think, of the complexity of trying to work through databases of this magnitude with this amount of data. And so we have been working with cyber experts to understand how best to approach this. We brought some expertise to bear to help our Eastern Health officials to get established. We've been working with NILCHI. So this has just been indicative, I think, of trying to coordinate a response to a very complex issue. And we don't have this all figured out yet. This will be another 6 to 8 weeks before we understand the total magnitude. And there is, we have full teams of folks who are working on this pretty much full time to get us there. So I think it's indicative of the complexity. We wanted to get to the point where, as we started to identify the first individuals who we could link personal information or personal health information to an individual name such that we could do disclosure. That was the point at which we thought we would have this conversation, because we wanted to set some context for members of the public who will start even after today to receive these letters. And so we didn't want people to start to get those letters cold in the mail without some understanding of background. And so that's what we're about today.
Thank you. And you indicated before that basically that the systems were being built back from scratch. I wonder if you could give us an update on that, like what percentage has been built back?
Well, I'm not involved on the NILCHI side in terms of the technicalities of the system. What I can say is, from a health delivery perspective, we are pretty much back to to our normal operations in terms of IT systems. So that's the piece of the business that is important to Eastern Health, is that we actually have the systems to do our business. And I think we're pretty much at 100% of that capacity at this point, which I would say again is quite an amazing feat. And I think the staff at Milchi and others within the regional health authorities who've been involved, hats off to them, because this was a massive incident and a massive response, and being able to, and we've been in this situation for weeks, so that's not today. It's not taken since November. In fact, very quickly, our systems were back to a high level of functionality, which is quite amazing when you study these incidents elsewhere.
Our next questions are from Ross Lord with Global National. Please go ahead.
Hello. Thank you both for talking and sharing your update with us. I just want to confirm, so I don't mischaracterize it. You know who did this, but you can't or won't tell us. Is that accurate?
We've been advised by our security advisors, local and national and international, that giving away details of the incident beyond a certain point would be unwise and would possibly jeopardize our abilities in the future to deliver services. So I'm not going to answer any more than that, Ross.
Okay. And also, to what extent are you sharing your experience and your findings with federal or national officials to prevent future attacks in your province or beyond, in the context of cyber analysts saying that there's a constant threat on larger levels to information systems across Canada, federally, for instance, possibly even in a new context in light of some of the international events in Ukraine right now. So to what extent are you sharing your experience and possibly what you might have learned with others?
I think it's fair to say that from the day this happened, or at least the weekend this happened, we engaged national and international experts in this field, and we continue to work with them. Obviously, law enforcement, the RCMP are involved, and we have spoken with the federal agencies such as, but not limited to, the Canadian Centre for Cybersecurity. So I would argue that we're fairly well plugged in, if you'll pardon the expression, to national and international groups who can help us and who we can help maybe in their future challenges.
Thank you.
Our next questions are from Ronelle Legros with All Newfoundland Labrador. Please go ahead.
Thank you. Good morning. My question's for Mr. Diamond. I know Eastern Health has put in over $4 million already into the services being offered through Equifax. I'm wondering if there's any more money been put into that contract in light of this incident and today's announced deadline extension?
No additional funding. We have lots of codes from our original purchase, and the minister gave some numbers early. So we have lots of room for additional patients and staff members to sign up using the investment we've already made. The numbers are perhaps lower than they could be. Again, because this is not an incident that is related specifically to SIN numbers or financial information, we're not needing to do anything additional in terms of purchasing new codes, but there's lots of room, and we certainly would encourage more members of the public and more staff members to take advantage of the investment that's already been made. So lots of room there for folks, and we'd encourage them even immediately to get on the website, get the phone number, and make the call. And over the next 2 to 3 weeks, I think we will have a new portal up and running, which should make that process even easier than it's been in the past. So we're encouraging people to do that. The investment has been made, and we don't feel we need anything else because we purchased enough pretty much for everyone in the province who feels they need this service to avail of it.
And Mr. Diamond, in rebuilding the system, how have you strengthened cybersecurity? And maybe further to that, is there a ballpark on how much has been spent to upgrade IT security?
Well, I think the minister has made some comments around the specifics from a technical perspective. I mean, one of the things I would say that from on the service end is, there's been lots of rigor now around passwords and around multi-factor authentication and new training opportunities for staff at all levels and physicians around cyber. So there, in addition to the technical pieces, which we probably won't go into, and frankly, that's a level of detail that I wouldn't be aware of on the service side. But there has been lots of work that has happened for us as individuals to put more rigor around how we're interacting with the system, and passwords and multi-factor identification are a couple of the things in addition to additional training in cyber.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Hi, good morning. My first question is for the minister. Did the province pay a ransom in order to regain access to assistance?
I won't be answering that question, Patrick.
Okay. And my second question, a few months ago, we got an estimate of the total amount of people who had been impacted through this cyber attack. Are you able to give an updated estimate on the total number of people who could have been affected through this breach?
I think the answer is no, not yet, because I think this latest the latest issue that we're speaking about this morning, we won't know for 6 or 8 weeks until we get through all of the data points how many individuals are impacted. I think the number will definitely grow from what we talked about in November. I think it'll grow by thousands. But I don't know. And some of the individuals impacted by this will be the same people who would have been impacted potentially before. So, the numbers, it'll be difficult and interesting to see how we come to a specific, how we rectify, because some individuals may be impacted, more than once in different aspects of this breach. So the numbers will grow, but I can't really give you an estimate of what that might look like at the end of the day yet.
I will now go back through each reporter to see if you have one final question. Ben Cleary with NTV, do you have a final question?
I do, thank you, and it's for Mr. Diamond. The NLMA estimated a couple weeks ago that there were about 6,000 backlog surgeries at St. Clair's Mercy Hospital and the Health Sciences Center. Is that number accurate, and how much influence did the cyber attack have on that backlog?
I mean, we have been having conversations over time with the NLMA, including as they were speaking publicly about those numbers. We have slightly different numbers. It depends on how you count and what you're looking at. I mean, our data, when we looked at it about 3 weeks ago, would say we probably have 1,000 individuals that we're very interested in getting through our surgical programs. So I don't want to debate the numbers, because you have to sit down and look at what people's assumptions are and how they're getting to that. There's no doubt we have, as a result of cyber and as a result of COVID, including the latest wave and staffing challenges and so on, that we're not at 100% of our usual capacity within our surgical programs. And so we're doing everything that we can in trying to balance the needs of staff that we've heard unions speak about in the last few days, which are very real. We're having those same conversations within RHAs and with government. I mean, the challenges of staff after 2 years of COVID are very significant. And then the challenges of trying to meet demand and backlog and pressures on the system are also very real if you need your surgery. And so that's the daily grind that we all face within the health system. And, I think our way forward, we've gotten through these last 2 years, I think, through the multiple challenges by really working together as stakeholders from, our political leadership and our government officials, our regional health authorities, our unions, the NLMA, and staff at all levels, our management teams. And that's how we'll get through the next period of time. And so certain wait lists, including the surgical wait lists, are a major concern for us every day. And that it really is the work of the day. Before I came on here, in a conversation this morning with our vice president, who is responsible for the operating rooms, talking just about that, is, where are we? What's our situation this morning? Where are we going to be tomorrow? How do we get as many people through the capacity that we have as possible?
Thank you.
Peter Jackson with the Telegram, do you have a final question?
Yes, the federal government just announced a $2 billion fund to help tackle backlogs across the country. How would that money be used here, assuming we get a few million that would be apportioned?
From our point of view, that's a discussion we're actually engaged in with the department staff and through them with each of the regional health authorities. Quite frankly, it's not clear whether that's a one-off payment or whether it'll be phased in over time. And certainly at the moment, our main challenge, as Mr. Diamond referenced, is dealing with our current staffing challenges. We have a very tired workforce who's risen to the challenge of COVID, I think 5 times now with the various waves, provided vaccination services in a stellar way. We lead the country in that, and also swabbing clinics and these kind of things. So it's very difficult at the moment to foresee piling any more work onto them until our wave recedes from COVID. Then, of course, there's the challenge of burnout, and it's the holiday season. So we've got time to figure out how we want to spend that money. The question at the moment really is, as Mr. Diamond said, dealing with our very pressing, tired workforce and how to support them through this.
Mark Quinn with the CBC, do you have a final question?
Yes, I do. Thank you. When we spoke with NAPE recently, they said that they've been told about 1,000 healthcare workers are unable to work because of COVID. I don't think that number includes nurses or physicians. Can you give us a total number of healthcare workers, including those other groups as well?
As of Monday morning, 784.
Thank you.
Richard Duggan with VOCM, do you have a final question?
Yes, this is for Mr. Diamond. When all of this started last fall, I know that Eastern Health was taking paper records of people's information while the systems were down. Just wondering if we can get an update. What has become of that information? Has that been switched over to the new system now that's up and running?
Yeah, it's a great question, and I can't give you a detailed response. I know there are teams between the regional health authorities and NILCHI who are tasked with that work, and so we can get an update for you. I just don't have that information. I know work has been ongoing, but I don't know what the current status is as of this moment.
Sarah Smelly with the Canadian Press, do you have a final question?
Yes, I'm wondering, will we be told what happened in the cyber attack, including what vulnerabilities you found in the system that perhaps led to this attack, whether there was a ransom, whether that ransom was paid, whether there was an encryption key, etc. And if so, when will we be told this information?
There are several investigations by outside agencies, including, for example, the Office of the Privacy Commissioner ongoing. Those will, in the fullness of time, each present a public report on their facet of this incident. In terms of operational security, there are considerations that would preclude publication of some information now and in the future.
Ross Lord with Global National, do you have a final question?
I do, thank you. So in talking with a cyber analyst, I remember back around the time this happened, there was a suggestion that these attacks don't so much look at a particular area, for instance, Newfoundland and Labrador, and say, I'd really like to get into that healthcare system. It sounds as though sometimes, at least, it's more of an automated situation where they find the weakest link in the chain. And in this situation, the Newfoundland healthcare system was a weak link in the chain. To what extent are you no longer a weak link, or are you not as weak as you were?
I think it would be safe to say we have taken steps to remedy the issues that we have found. I think beyond that, it would be unwise to go into too many specifics, again, for reasons of security. It's a bit like giving a burglar your passcode for your alarm system.
Yeah, I'm not looking for passcodes. I'm just looking for, even in a general sense, how much stronger you are now.
I think it's difficult. There are companies out there that will give you a security rating on your IT systems. Certainly, that's one element of assessment that we would be looking at in conjunction with our advisors and partners.
Thank you.
Ronelle Legros, All Newfoundland Labrador, do you have a final question?
Yes, I'd just like to follow up there on Sarah's question, perhaps for the minister. You mentioned that you are expecting a report from investigators once the investigation has concluded. Do you have any sort of timeline as to when you might be expecting that?
I can't speak for those investigation agencies. They do their thing, and we give them the access that they need to do it. So, for example, with the Privacy Commissioner, I would direct you to his office. I believe he's given an estimate. With the RCMP, for example, my understanding is it's not usual for them to comment in any significant way about their investigation. So I really can't help you further on that one.
Patrick Butler with Radio Canada, do you have a final question?
I do. This one's for the minister again. I received a response to an access to information request yesterday that shows that an external firm, National, was hired to help run communications in the first few days of the attack. Why was that necessary? And would you be able to provide any details on how much the province paid this firm to do that work?
There were agencies outside that were retained and are on retainer for assisting us with various aspects of this cyber incident. I don't have that detail. And again, some of the agencies involved for security reasons will either not be identified or those questions won't be answered at all.
Thank you, everyone. Minister Haggie, do you have a final comment for today?
Just again to acknowledge the tremendous work that the staff of the regional health authorities and NILCHI have done on top of 2 years or 18 months of a real challenge with the pandemic. Again, I don't think it's excessive to keep thanking them for their efforts and their ongoing work. I'd like to thank everybody for their attention this morning. And as our medical officer of health would say, stay safe. Good day.
Thank you, Minister. Thank you, everyone, for joining us, and enjoy the rest of your day.